welcome to another episode of The Heart of the Matter. My name is Omilola Oshikoya. Breast cancer continues to receive awareness in many forms in our country or in Africa. However, we must begin to turn that awareness into action. Our topic for today is From 90 to 90, Turning Breast Cancer Odds in Our Favor. And we have with us Ebele Mbanugo and the Run for a Cure Africa team. Hello, Ebele and Chiedu.
Hello, good afternoon.
Welcome to the Heart of the Matter, and thank you for coming on the show. So could you tell us what Run for a Cure Africa stands for and the story behind it?
Oh, wow. That's a weighted question. What we stand for, essentially, we want to give every Nigerian woman a chance to fight breast cancer on equal ground. So I would say if I had to summarize what we stand for, that would be it. Run for a Cure Africa started in 2009 because my mother had breast cancer. In 2007 she was diagnosed, and at the time I knew nothing about breast cancer, and my aunt actually was diagnosed with colon cancer in the same month as my mother, and sadly she lost her battle in 2008. And it was at that time that I realized, we had really dodged a bullet as far as cancer was concerned, because my mom at the time had, gone through her treatment, and, everything was okay at that point. And so that kind of inspired me to give, because my mother's Nigerian, I'm Nigerian, and that inspired me to want to start a program where Nigerian women all had the same chance at survival. And so that's, in a nutshell.
So is your mom based in Nigeria?
At the time, she was based in the U.S.
Okay.
Sadly, she passed away in January, so she's no longer. But she was based in the U.S., and so she received all of her treatment in the U.S.
Okay. So why the run? What's the run?
Well, there is a famous nonprofit in the U.S. called the Susan G. Komen Foundation, and they actually helped when my mother was going through her issues. And so the story is quite funny about how it started with the run, because I was thinking I wanted to give back in one way, shape, or form. So I was saying, okay, that I would organize a run, much like the Susan G. Komen run, and the money that we raised from the run in Nigeria, I would now send to Susan G. Komen. But a voice, which I call the Holy Spirit, said to me, if you try and raise money in Nigeria for America, it's not going to go over well. So it was at that point that I was like, okay, we could do something similar in Nigeria. And so that's how we started with the run.
So what does it? What's the process?
Well, the run, it really is. It has turned into a movement. We started in Lagos in 2009, but now we're in Cameroon, we're in Ghana, and funnily enough, this past April we were in the U.S. for our first run in the U.S. in 2016. But essentially, we just call people out to the streets and we run. And that is a way to create awareness to...
So do they pay?
Absolutely, yeah.
Okay.
It is a fundraiser of sorts.
Okay.
So we do have people register. They pay, they get a fantastic shirt and a goodie bag. But at the end of the day, it really is an opportunity for us to...
Create awareness.
Yes. And it's funny because when people see, because we have over 1,000 participants each year, when people see these huge amounts of people on the streets, they ask, why are they there? And that is the beginning of a conversation that we need to have in this country.
Okay, so cancer is such a hard subject. So how have you been able to confront it, especially with the people that need the help and also the people that can support you?
Well, it hasn't been easy. Yeah, just creating the conversation, because like you said, it's still taboo in Nigeria. A lot of people don't want to talk about it because sometimes they feel if they talk about it, it's kind of like calling it to them. And so, that's kind of the challenges that we face with just broaching the subject, especially with Nigerian people, especially with Nigerian women. But I find that it's getting better. In the beginning, we couldn't convince anyone to come out and say that they've had this disease and that they've battled it and they've won.
So it's the fear factor.
It's the fear factor, and the fear is not just fear of dying. It's fear of being stigmatized by your community and people saying that surely you've done something to bring this bad energy onto you. So it's just a fear of that. So
who's a pink fighter?
Well, pink fighters are women that have come through our program and received treatment. So we have over 40 women that have been through and received treatment, and they are advocates for us to help spread the word and encourage other women to, you know, acknowledge the challenges that they're facing. Exactly.
So, aside from create the awareness to the run, how does it work?
how does what work?
So what else do you do? How do you turn this awareness into action?
Okay.
Yes.
It is a 365, and if there were more days in the year, we would be doing that. It's a morning to night battle. But essentially, you know, when we started, it was just about, okay, let's purchase a mammogram machine so that women can get free breast cancer screenings. And once you uncover that layer, then another layer is, oh, okay, women aren't coming out for the screenings, so now we have to go to where they are to create that awareness. And so we would have to set up makeshift clinics in the most rural areas of Nigeria. After that happens, then you struggle with, okay, now they need help with treatment, because the average Nigerian earns 18,000 naira a month, and one round of chemotherapy is 153,000 naira. So now we have got to find a way to, you know, get them treatment. And so you get to that part, and it's like, oh, the hospitals have gone on strike. We have to find an alternative resource for them. So it's just, we're learning, and it's just layers that we're peeling off, and at each interval we have to find a new way to fight.
Could you share one of your success stories with us?
One of the stories, which, I mean, I smile every time I talk about her because she is such an inspiration. It's a mother of 6.
Wow.
Yeah, and she was diagnosed with breast cancer, and a lot of the people that come to us for support, you know, they're obviously shaken up and they're crying and they're like, please help me, help me, help me. And what struck me about her was, you know, she quite pointedly said to me, I'm not going to die from breast cancer. It's not going to happen. And so I would appreciate your support, but whatever it is, I'm not going to die from it. And lo and behold, she is alive today. She did all of her treatment here in Nigeria. So for me, that is, and she has no qualms with coming out. Whenever we ask her to come out and speak, happily she will come out and tell people, you know, her story.
Chiedu, I'd like us to talk about a project that you launched in 2016, but we'll do that after the break. We need to take a quick break. Viewers, we'll be right back after the break. Please stay tuned for more on Gift's story. Igeme ko bidi mama amaram igeme muko bidi mama. I said, God, I know that one day you will make me happy. You will make me smile again. And God opened a way. He led me to run for Cure Africa, and they make me smile. The first day before I met you people, I gone round to the big churches, nobody. So if there was no Run for Cure, I don't know how I would have been. Every night when I sleep, midnight I wake up, I will begin to cry. My husband will be crying. When I start crying, he will be crying. I said, I don't know that this is how my life will end. But the Almighty God used this very particular organization to help me, and I survived it. I never knew that one day
I will be able to sit down like this.
Welcome back to the Heart of the Matter. We still have with us Ebele Mbanugo and Chiedu, the Program Director for the Run for a Cure Africa team. In 2016, you launched a clinic in Lagos State University Teaching Hospital. Could you tell us about that?
Sure. March 8th, 2016, we launched the breast clinic at Lagos University Teaching Hospital. And the breast clinic is designed to provide diagnosis and treatment for breast cancer patients all in one location.
Okay, so is it like paid? Do they pay for this, or is it free?
Yes, it's a paid service they pay for.
Okay.
Yes.
And how have you been able to fund all that you're doing?
We do a lot of singing and dancing. No, I'm just playing. Well, we do have corporate sponsorship.
Okay.
And then we do have support from individuals and associations that believe in our mission and our vision. And so it's not easy. I don't want to make it sound like, we just ask and people give it to us. But I think that cancer affects a lot of people, and our mission resonates with a lot of people. And so, people want to make a difference in one way, shape, or another. So.
Okay, so our CFA has evolved over 9 years, but what areas in breast healthcare do you actually address? What specific areas?
Well, really, we're screening, education, and treatment. Just recently, we launched our Patient Navigator program. You want to tell her about the Patient Navigator program?
So we just recently launched a Patient Navigator program, which essentially is designed to identify and address barriers to care that a breast cancer patient may face. So the Patient Navigator is essentially the patient's #1 advocate, helping educate them so they can better understand their breast cancer, what that means, what their diagnosis means, helping them also understand their treatment plan.
Is this like a one-on-one thing?
Yes, it's a personal relationship. They'll help them make sure they're following up on appointments, assist them with any questions they may have. They can also help liaison between the patient and the doctor, making sure that all instructions are being referred back to the patient, and any questions the patient may have, they can go through the Patient Navigator to reach the doctors as well.
Okay, so what exactly are the stats? How bad is it?
It's bad.
Really?
Off the cuff, Dr. Fumio Lopade, who is a University of Chicago professor, and also she sits on the National Cancer Advisory Board in the U.S., she said in Africa, the breast cancer mortality rate is 90%. 90%. So 90% of the women diagnosed with breast cancer will die from it. Wow. Whereas in the U.S., it's a 99% survival rate.
Wow. So 90% mortality rate in Africa, whereas in the U.S. is 99% survival rate.
Exactly.
So why is this?
And that's why awareness can not be undervalued.
So is it a lack of information, lack of detecting it on time, or just the lack of treatment or good health care?
Well, it's a combination. It's a scary combination of it all. But essentially, it is late diagnosis. 75% of the women that are diagnosed at stage 4. And stage 4 is the last stage. And so when you're diagnosed at stage 4, the cancer is very difficult to treat. And then once you're diagnosed, the financial cost of fighting breast cancer is enormous. And so that's why we really advocate for early detection, because, early detection, it's a 200,000 Naira problem versus a 5 million Naira problem when detected late. And, the Patient Navigator program really was born out of this, in the sense that, like Chiedu said, this person is an advocate. She sits alongside the woman that's been diagnosed, and she kind of is like her coach through the journey. We had a patient who we had taken on her treatment cost, and because she had started to feel better after doing a few rounds of chemotherapy, she stopped going. She stopped receiving her treatment. And in the end, she, when the cancer had spread, she had come back to say, okay, that I'm not feeling well again, but at which time it was too late. And at the end of the day, that is an indication to us that it's not a matter of paying for the treatment. You need somebody to explain what this means, what your treatment means. Yeah, guide you. And so, you know, the Patient Navigator program is really a vital, if not the most important piece to what we're trying to do with breast health care in Nigeria.
Okay, let's take another break and then we'll continue after the break. Viewers, stay tuned. We'll be right back after the break.
Our runners only. It's very important so that we don't have a troubling situation at the starting line.
I believe the run is, yes, it's a great fundraising mechanism, and it's our largest fundraising mechanism, but it's also our awareness mechanism.
Can my pink fighters come to the stage? To you all that take care of me, may the Almighty God bless you all.
When we started, all we thought we had to do was create an awareness of breast cancer. 6 years into it, we realized after we've created that awareness, we have to provide a place where women can get screened for free. And after we do that, we have to provide a facility where they can fight breast cancer.
Welcome back to the Heart of the Matter. We're still talking about turning breast cancer odds in our favor. There's something you said before we went on the break, that the mortality rate in Africa is 90% and the survival rate in the States is 90%. Now that is alarming. 99%. Now that is alarming, that is huge. How can, and clearly something that is very big, I don't know if you can even solve this problem on your own, but people that would like to help you, how can they help and what should they do to contact you?
Okay, definitely. Like you rightly said, this isn't something that Run for a Cure Africa can do by themselves.
Yeah. And what kind of help do you even?
Well, you know, it's not so much about, you know, donating money, even though that's fine as well, but partnerships. You know, at the end of the day, we need partners in this fight because it's huge. So essentially, you know, we partner with different companies that want to do CSR with their employees. Okay. We partner with associations that don't mind volunteering, don't mind getting out there and getting their hands dirty. So definitely partnership. And so if anyone is interested, they can send us an email at info@rfcafrica.org or give us a call on 0802-287-6660. But we also wanted to give out the information for the Patient Navigator, because one important piece to patient navigation is it's not just women that have been diagnosed with breast cancer, but anyone that wants to learn more information about breast cancer, how to reduce their risks, or if they have any questions concerning their breast health, the Patient Navigator is also there for that purpose, and she can be reached on...
Sure. Her number is 081-7000-1235.
Okay. What's the person's name?
Olayinka.
Olayinka.
Yeah.
You tried. Okay, before, I want to talk about the future plans, but before we go into that, how can people reduce the risk of breast cancer? Because prevention is better than cure anyway.
Absolutely. You know, I'm not a doctor, and I always say that before I dole out the information, but just someone that is immersed in everything breast cancer, the number one risk factor is just being a woman. So that's one. But then two, what we can do is definitely live a healthy lifestyle.
So our diet.
Yeah, our diet, be active, reduce your alcohol intake, reduce your stress levels. And then the biggest thing is get screened annually. Women before the age of 40, go for a clinical breast exam. We offer several throughout Lagos. yearly.
Affordable? Is it affordable?
Well, the ones that we offer are actually free.
Okay.
Yeah, so we offer them at the Lagos University Teaching Hospital, and also we have a partnership with ShopRite.
Okay.
And they support our screening program as well.
So you can walk into a ShopRite store.
No, do not
Okay,
walk into
sorry.
ShopRite. Say I want a free breast cancer screening. No, we hold events on different ShopRite premises.
Okay.
And so to learn about our upcoming screening, you can go to our website and it will have information. We're going to have a free screening in July at their upcoming Lekki facilities. So yes, so that's very important to get screened annually. If you're over 40, it's important to get your mammograms, and that also we can support you with. And then outside of that, just recognize the symptoms of breast cancer. Well, there are several, but the most obvious one is the lump in your breast or the armpit area. Outside of that is a pain that won't go away, if there's skin discoloration, or if you have nipple discharge and you're not breastfeeding, and an inverted nipple. Those are all the glaring signs that, you know, there is an issue. It's not to say that it's immediately breast cancer, so don't panic. But those are the symptoms of breast cancer. And so just being breast aware, I would say you just have to be proactive. I always believe it's not something that you should be afraid of. You have to do your part, and then you let God do the rest. So.
Exactly. Could you please tell us what the future plans for RFCA
Okay, no
are?
problem. So essentially, our overarching goal is to change the conversation around breast cancer in Africa. In order to do that, we need to expand awareness. We need to make sure that women and people in general understand that breast cancer is treatable if detected earlier.
Yes.
So creating that conversation, I think, will go a long way to changing the mortality rate. Reversing it is actually our goal. We want to continue to expand our programs, our screening programs, our clinic as well. If we can have multiple locations in the future, is something that we're working on developing.
And that Patient Navigator program is going to be essential in everything that we do, because it's not enough to tell a woman that she has breast cancer and even support the cost of her treatment. She has to understand what it is that she's going through, and she needs an advocate and a support.
And even the family as well.
Absolutely,
They need
absolutely,
some
absolutely,
support.
absolutely. Yeah.
Thank you so much for coming on the show. It's been very educative, and I'm sure our viewers that are watching would reach out. Your details have been on the screen, you know, and they would reach out to you to support you anyway. And I wish you all the best.
Thank you very much.
And we will reduce the mortality rate. We'll reverse it to 99%, 100% survival rate in Jesus' name. Amen. Thank you. Viewers, we hope you have enjoyed this episode. If you'd like to get more information on Run for a Cure Africa, if you'd like to support or you need help, please reach out to Ebele or Chiedu. The details have been sent. It's important that you check yourself early. Let us fight breast cancer. Let us turn the mortality rate in our favor. Thank you very much. Until next week, stay blessed.